Hi, this is Vanessa Love and this is my channel. I usually talk about mental health stuff. Today it's related, but sometimes I don't, and that's okay. So today I want to talk about cybersecurity, HIPAA, and your information. And there's lots of reasons for this, but yeah, let's get into it. Okay, so first, every high school, like every college that I went to, eventually my information was compromised on their servers because I guess they don't think about cybersecurity at a college where they have a lot of information on their students, like finances, social security numbers, birthday, all of the things that you would need to like steal someone's identity. They have it on their computers. Let's see. I also had my information stolen off of some old storage of like T-Mobile, which I'm like, you think after 10 years you would have just deleted my information, but nope. Didn't have the phone number or the account that they still had on file, and it had been like 6 or 7 years before they even like before there was a data breach, and luckily when my information was compromised, because I did an internship at a government agency that the government gave me some credit monitoring. So and I also have signed up for information from, I think, Experian and TransUnion, and then there's the other one. You can get your credit report from a free annual credit report or something, or annualfreecreditreport.com. Look up free annual credit report and go to the government website. That will give you the correct one, because it is important and you should know what's on your credit record, no matter what. I don't think that people know to do that, and you don't have to pay for like Credit Karma or whatever. Experian and TransUnion have the information. They send me information, I think once a month at least, that just is like, hey, credit's good, sure, go do. So yay. But it's good to just look through it, because it might have an address that you didn't actually live at, but maybe received mail there, or like someone moved and like your information kind of got mixed up, like if you had an ex, whatever, sometimes like that information can get mixed in. So important to look at it and see what is on there, so that you don't get a question one day that's like, did you live on this street? Like, no. And it's like, yeah, we think you did though. Like, oh no, that's not it. Yeah, fun times. So there's that. So I have been fortunate enough to keep up with the service that the government provided when my information was compromised, and luckily there hasn't been anything significant on there. If anything, I've been very fortunate. One of my friends, who has unfortunately now passed, she had her social security number stolen, and they bought a house when she was 8. She had to like fight this in the early days, and she got a new social security number, and that one got stolen too. Some people have really bad luck. I don't know what to say. So now there's the issue with BetterHelp. I think that things are fucked. I don't know how else to say that, but just, it's like the tech companies, if they're going to get into healthcare, have to understand what data privacy and cybersecurity is, but they don't. I don't know why they don't understand HIPAA compliance. And then you have the other thing, which is that health companies don't know technology well enough to know to have a cybersecurity site. It's all about cybersecurity, really. And the other issue that's very scary is that if a data breach is small enough or the company isn't publicly traded, they don't have to tell you ever. They don't have to tell you. Like, the amount of shit that is so messed up. So, like, you could have already had a data breach, but it was so tiny that, you know, they're just like, we're not going to actually say anything to you. So BetterHelp, the FTC came in, issued a fine. They had a lot of issues. We all know that they had a lot of issues. They were not paying therapists, that there were issues with contact between therapists and clients. Clients were upset sometimes. Therapists were, I mean, I think one therapist I heard got $5 an hour. Like, how ridiculous. Like, that I can't imagine. And I guess when you signed up, because it was a tech company and they didn't have to give a shit about HIPAA, they sold information. They sold information while people were trying to get mental health, information and treatment and help. Their information was sold. And again, when you don't give a shit about data security, like cybersecurity, data protection, any of that information, even signing up, could be in the hands of anyone who paid for it. I have a couple of clients who are in data security and cybersecurity. One of them said something that I was like, oh shit. He talked about his access and how there are times where he could technically access any information that he wanted to on any of the servers because he has access. And someone who might not have the best of intentions can get people's emails and passwords, their date of birth. All of this information is stuff that can be used to put things in your name and ruin your credit, which would mean also that anything about your future, this is why this is important, anything about your future could be at risk. You might not be able to get jobs, you might not be able to get apartments, you might not be able to get cars, you might not be able to do some things that require a background check, that require a credit check, because your credit could be ruined, your identity just out there for someone else to use what they will. It's not great. And I know that many therapists use these things called electronic health records. First of all, the insurance companies already are too big and don't know what the other one is doing. Like, if I called whatever local Anthem, United, Aetna, whatever in, let's say, Illinois, they have no idea what's going on in New York or Connecticut. They just don't know. They don't know. They have my information, they have your information. They don't know. They don't know. So then we get to the electronic health records, the EHRs. If I was ever going to use an EHR, I would grill the shit out of their cybersecurity. Be like, when was the last time? And there, you have data security auditors. What was the last thing you found? When was the last, possible threat? How did you deal with that? Oh my God, I would be the annoying person who's asking, all of these things, because I would need to know the information to know that my client's information is safe. I have already been through the worry of, oh crap, I don't know where my information is. And twice at San Diego State, it was breached. I only know about two, actually. There might have been more. We don't know. So, these type of things are really important to ask and to understand, especially if there's any third-party vendors to any thing, and as I was talking about this last night, I realized that I have not properly vetted the telehealth platform that I use. I know that when I was looking for telehealth platforms, it was before COVID, and I chose a company because they had a couple of options that were more reasonable. At that time, Zoom, first of all, Zoom wasted my goddamn time. So they were like, if you're interested, you have to have a phone call with us. And I was like, just give me the time, just give me how much it is, and I will tell you whether or not I can pay that. And they were like, no, phone call first. In the middle of the phone call, I was like, yeah, I can't afford this. I'm not going to use this that much. I might not use that often enough to, offset the cost. And they were like, well, we can't do anything about the cost. It was $200 a month at the time because it was HIPAA compliant. They're like, we can't do anything about the cost because this is what it costs to be HIPAA compliant. That was it. That was the only thing. That's how it was. And I think I had maybe one or two clients who I could see after I signed the information for Anthem to be a telehealth provider because that was required at the time. And so I think I had maybe one or two people who I could actually do like possible, HIPAA Zoom meetings with. And, there comes, issue with that. The platform that I have been using, they have third-party vendors for some of their things, so I kind of want to know. And some of those things are so clunky, they're bad. I have not used a lot of the things that were included in the next level up that I might not actually want to use them anymore, but that would leave me with using possibly Psychology Today, and Psychology Today likes money. I can look at maybe where they're situated so I can see whether or not they are a little bit better. Sorry, the sky is clearing a little bit after the Canadian wildfires are kind of blowing this way. So I'm like, oh hey, it's not as orange. Wow, it's really not as orange as it was. It was getting grim about 30 minutes ago. Anyway, so Psychology Today, they only care about money, but if they are listed maybe in somewhere in Europe, then they might have stronger security measures than what they have in the United States. All of this is very important. You do have to know where your information is going, and this is, again, the same issue that I brought up with MultiPlan. I don't understand when I submit your information, that should go from the approved website, right, where I can put in my claims and submit that to the insurance. And we've both agreed that this is the one website that we can use, right, to submit a claim. I'm not submitting a claim always directly. I'm submitting it through a clearinghouse. So this is the clearinghouse website, and it goes directly to, let's say, Anthem or Aetna or Cigna or whatever, right? Then where does MultiPlan get that information? How do they intercept that? That freaks me out. And why is this other company involved in any of it, saying that they can get their clients as well as their providers better costs? I think this only benefits the clients and the insurances. It doesn't actually benefit the therapist who would be taking a pay reduction. Whereas if they just were on the insurance panel, then they could just get the money from the insurance. You understand what I'm saying? They're not rooting for us, they're rooting against us. And they might be doing something funky with clients' information. And again, I feel the more that there's more steps in between anything, and the more possibility of people seeing your information, the more that those people could possibly steal your information. That's my concern. The more steps there are, the more that there can be people here, and taking that information. And there could be rings of people who are taking this information. We don't know. I mean, you know, they might have to do background checks, but if, you know, they're new, if they're overseas, you know, they might not have the same laws, restrictions. Bunch of people hire each, you know, like, can't find them. But they could definitely infiltrate a company, you know, say, oh yeah, of course, we're HIPAA compliant. We can answer your phone calls. You don't have to deal with that anymore. Right? So, yeah, like, I mean, call centers are call centers, right? So there's also a possibility that outside of Europe, it would be a little less strict, maybe not as compliant. There's a lot to this, and I'm really hoping that you think about where your information is and where it's going, because there's a lot that we just really shouldn't be so willing to give our information. And my opinion, it shouldn't be entirely required when it's not necessary. You know, oh, you want to sign up for X amount of website? Apparently it's illegal for you to not use your real name, which I'm like, not how other people grew up with the internet. Like, yeah. And I'm like, you should be able to lie for some things, because I'm like, there's a lot of websites they shouldn't have your information. That, like, they just like, what is it other than sitting on some, like, a data center, in some data center somewhere. And, like, also to understand about the cloud storage, it is physically in a place somewhere. It might be in 4 or 5 different places sometimes, right? But it is physically stored somewhere. It is not actually ethereal or whatever. Ethereal? It's not in the ether. It's not in the ether. There's a physical place for it. So where is it? How do they manage with natural disasters? When's the last time it's been checked for protection against natural disasters? When was it through national disaster? Because I mean, like, if they're like, there's plenty of space, right, in other places in the United States. So I'm like, well, Alaska. How do they manage with Alaska compared to, like, if it was in Arizona or in North Dakota, Idaho? There's huge data centers with your information. And again, by the way, hospitals aren't great about destroying your property either, your information. It's very, very, very possible that your information is on an old computer abandoned in the basement of some hospital somewhere, and they don't know how to properly dispose of that or clear out the information. Fun times, right? All of the information that you really have to, like, you know, you might be concerned about, you might be worried about, that, you know, validly so, you have to be concerned. And the other thing is that if you ever get treatment in a facility, make sure that they are aware of, like, you don't want your information out. There was one person I respected a lot when I was doing my internship at an inpatient facility, and he was like, you can take my medical record with you into your office and close the door. Do not have my file out, your door open, and people can see my information. I don't want that. And I'm sure that people, oh no, that doesn't happen. It happened everywhere. It happened all the time. And yeah, like, there were some things there that I was like, yeah, one time, like, I was like, I think someone, like, might have bought some things on my card. I was like, I suddenly, like, after starting working there, there started to be weird charges on my card. I immediately reported that, obviously, and then told my manager and was like, it's very possible that this was just coincidence. I don't know, but like, here's what happened. And then after I moved my purse to a different spot, it didn't happen again. So I'm like, sounds like something happened, and I don't entirely know what it was. But it's very odd, and it's one of those things where I'm like, And I think she said something to the effect of, oh no, that person's always in their office. Your stuff is safe in there. It was not. It was not. She would leave the office for like 5-10 minutes. You know how easy it is to reach into someone's bag and pull out their information? Probably pretty fucking easy, you know? So no, like, you can't be like, oh no, it's fine. It's not. No. Be vigilant and be okay with being a jerk about it. Like, your information is your information. It should not be stolen. It should not be out there. It should not be available for other people unless by, you know, like, it has to be for some reason, you know. But other than that, no. Like, make sure that your data is kept to you. It's kept personal, you know, like, that you protect yourself. Companies don't always care about that, unfortunately, and like that you know where your information is going, and you should be asking questions, and therapists should be asking questions, and there should be better restrictions. There should be more cybersecurity because it's necessary at this point. You can't just be like, oh well, maybe it won't happen. It will happen. It has happened, and no company is away from that. You know, I could accidentally download something today and give everyone's information on accident. You know, whose fault is it? Absolutely fucking mine. Right? Anyway, hope that was helpful for you, and I will talk with you soon.